Hello and welcome to this channel. In this video we will talk about chronic illnesses and strategies for coping and living with them. Chronic illnesses are long-term health conditions that can have a profound impact on a person's life. These illnesses can range from diabetes to heart disease to autoimmune disorders and more, and can be difficult to manage and live with on a daily basis. Despite the challenges that come with chronic illness, it is possible to maintain a high quality of life and find ways to thrive. In this video, we will try to find strategies for coping and thriving with a chronic illness and talk about why it is so important to deal with chronic illnesses on different levels. There are hundreds of different chronic illnesses, and they can be classified into different groups depending on their causes, symptoms, and treatments. There's, for example, cardiovascular diseases, which are chronic illnesses that affect the heart and blood vessels, including heart failure, stroke, and hypertension. Also, respiratory diseases, chronic illnesses that affect the respiratory system, such as chronic obstructive pulmonary disease and asthma. Also neurological diseases, which are chronic illnesses that affect the nervous system, such as Parkinson's disease, multiple sclerosis, and epilepsy. There are also musculoskeletal diseases, endocrine diseases, gastrointestinal diseases, immune diseases, and mental health conditions. One of the big struggles for patients with a chronic illness, no matter of which part of the classification, is that the treatment is usually symptomatic, but that the illness is not possible to be cured. That's why coping strategies are important for patients with a chronic illness. They help individuals to manage the psychological, emotional, and physical stress associated with their condition and the knowledge that the illness will likely be with them for life. Coping mechanisms can help patients to better understand and accept their illness, regulate their emotions, improve their quality of life, and maintain their overall well-being. Effective coping strategies can also reduce symptoms and improve outcomes. In addition, using coping strategies can empower patients and promote a sense of control over their illness, helping them to feel more confident and resilient in the face of challenges. Chronic illnesses often put a range of burdens besides the actual disease on a patient. Those include physical symptoms. Chronic illnesses often result in persistent physical symptoms that can be painful, debilitating, and interfere with daily activities. Chronic illnesses also often come with emotional distress. Living with a chronic illness can result in feelings of anxiety, depression, helplessness, and stress. Chronic illnesses also often result in increased medical expenses, loss of income due to time off from work, or the inability to work and reduced ability to earn a living. Also, some people with chronic illnesses face stigma and discrimination in their communities, at work, and in the healthcare system. Unfortunately, also people with chronic illnesses may face barriers to accessing necessary medical care and treatments. Chronic illnesses can also make it difficult to carry out normal daily activities. Chronic illnesses can also place a strain on personal relationships and affect one's ability to participate in social activities. The unpredictable nature of many chronic illnesses can cause uncertainty and unpredictability in one's life. These challenges can be difficult to navigate and can have a significant impact on a person's quality of life. How can a patient with a chronic illness deal with those struggles? One of the most important steps in managing a chronic illness is to develop a strong support network. This can include family members, friends, support groups with other patients that have the same disease, and healthcare professionals. Having a network of people who understand what you are going through can provide a source of comfort, encouragement, and practical support. How can a patient find a support network? There are many different ways to find a support network for chronic illnesses. There are online support groups. Many online forums and social media groups exist for people living with chronic illnesses. These can provide a virtual community of support and a place to connect with others who understand what you are going through. There's also patient advocacy organizations. Many advocacy organizations for specific chronic illnesses exist, such as the American Diabetes Association, the American Heart Association, and the National Multiple Sclerosis Society. They often offer resources and support services, including support groups, counseling services, and educational programs. Also, in-person support groups are another option. These can be found through local hospitals, clinics, or community organizations. They offer a chance to connect with others in person and build relationships with people who understand what you are going through. Healthcare providers, such as doctors, nurses, and social workers, can be a valuable source of support and information for help groups. They can provide medical advice and connect you with resources and support services in your community. Also, don't underestimate the power of the support of friends and family. They can provide emotional support and help with practical tasks such as transportation or meal preparation. Another crucial aspect of managing a chronic illness is to take an active role in your own care. This means working with your healthcare provider to understand your disease, develop a treatment plan, keeping track of your symptoms and hopefully their improvement, and making lifestyle changes as needed. Also helpful can be to find a hobby or activity in which one finds joy and distraction from the symptoms of the chronic illness. Adopting healthy habits, such as eating a balanced diet, targeted at your disease, exercising regularly as fitted for the chronic condition, and getting enough sleep can help to improve physical and mental well-being. Patients are usually also advised to keep a journal of their symptoms. This can be in the form of a notebook, on the smartphone, in an app, or in any other way. This can help to identify triggers, but also to have a visualization of the improvement of disease-associated symptoms. Important is in a symptom journal how the symptoms are noted, for it to be a valuable source of information for the patient himself, but also for the healthcare provider. A symptom journal should include the following points to be effective: the date and the time. Record the date and time when each symptom occurs. Also write a clear and detailed description of each symptom, including the location, duration, and severity. Note any triggers that may have caused or worsened the symptoms, such as stress, certain foods, or physical activity. Also keep track of any medications or treatments you are taking and their effects on your symptoms. Record your sleep patterns, including the number of hours slept and the quality of sleep. Keep a record of what you eat and drink each day and any changes in your appetite. Also note any changes in your mood or energy levels that may be related to your symptoms. Track your physical activity, including the type and duration of exercise, and any changes in your ability to carry out physical activities. In addition to seeking support and taking an active role in your care, it is also important to adopt positive coping strategies to manage the stress and challenges that come with a chronic illness. This can include practicing mindfulness, journaling, engaging in creative pursuits, and setting achievable goals. Seeking out enjoyable activities such as hobbies, social events, and physical activities, can also help boost mood and promote a sense of well-being. It is also important to be proactive in managing physical and emotional symptoms. This may involve taking medications as prescribed, seeking out complementary therapies, or finding ways to manage pain and discomfort. Finding effective pharmacological treatment can help to improve the overall quality of life and reduce the impact of the illness on the patient's daily life. The medications that will be prescribed depend on the chronic illness, but there are generally a few groups that are likely going to be used. Those are, first of all, pain relievers. Pain relievers such as acetaminophen, ibuprofen, and prescription opioids can help relieve pain associated with chronic conditions of different kinds. Second, anti-inflammatory drugs. Anti-inflammatory drugs, such as corticosteroids, can help to reduce inflammation and swelling associated with certain chronic conditions. Third, disease-modifying drugs. Certain chronic conditions, such as multiple sclerosis and rheumatoid arthritis, can be treated with disease-modifying drugs, which help to slow down the progression of the disease. Fourth, antidepressants and anti-anxiety drugs. Depression and anxiety are common in people with chronic illnesses, and these conditions can be treated with medications such as antidepressants and anti-anxiety drugs. Fifth, hormonal therapies. Hormonal therapies such as insulin for diabetes and thyroid hormone for hypothyroidism can help to regulate hormones and manage symptoms of certain chronic conditions. And last, antibiotics. Chronic conditions such as cystic fibrosis and some autoimmune diseases may require long-term treatment with antibiotics to prevent infections. Finally, it is important to remember to be patient and kind to yourself. Chronic illnesses can be unpredictable and can have ups and downs. Accepting that there will be good days and bad days, and focusing on what you can do rather than what you can't, can help you maintain a positive outlook and build resilience. In conclusion, living with a chronic illness can be challenging, but it is possible to manage the condition and maintain a high quality of life. By developing a strong support network, taking an active role in your care, adopting positive coping strategies, and being patient and kind to yourself, you can find ways to thrive despite the challenges of chronic illness. That's it for this video. I hope it was helpful, and if you like our channel, please subscribe. Thank you for watching, and hopefully see you again in the next video.